Faced with the spread of a then unknown virus, the Chinese authorities declared a quarantine in Wuhan on January 23, 2020. The decision, announced in the middle of the night, shocked the city's 11 million inhabitants. But a total lockdown would not begin until mid-morning, giving residents a few hours to flee the city. At 10 a.m., Wuhan looked like a ghost town. The strict quarantine would last for more than 2 months. Earlier, on January 1st, the Wuhan live animal market had been closed on suspicion that it was the source of the epidemic. A local doctor, Li Wenliang, was one of the first to warn of the danger of the virus, but the Chinese authorities tried to discredit him. He was summoned and accused of spreading false rumors. On February 6th, Li died of COVID, triggering a nationwide emotional outcry.
He just tried to tell the truth, and then he was warned off by the public security official.
Another whistleblower, blogger Zheng Zhan, traveled to Wuhan in February to document what she saw in hospitals and in the streets. Her live streams and essays were widely followed, but upset the government in Beijing. She soon disappeared, only to reappear months later to announce that she had been sentenced to 4 years in prison. She was not released until May 2024. The government built a makeshift hospital in Wuhan to handle the outbreak. 5 years on, it is in disrepair. Since then, life has returned to normal. In front of the camera, residents say they have turned the page.
When they fully relaxed COVID restrictions, that was when I felt that everyone opened up and began to return to how they were before the pandemic.
These memories are getting fuzzier and fuzzier, but they still impact us. Those few years were particularly tough, but a new life has started anyway.
The WHO has attempted to identify the origin of COVID-19, but the Chinese government has impeded its efforts to investigate. To date, there is no certainty as to how or where it began, or even if the epicenter was indeed Wuhan.